Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with board-certified cardio-thoracic surgeon, Dr. James Martin, and we're going to be talking about the aortic valve. Dr. Martin, can you remind us what is the aortic valve? Where is it located? What's its purpose?
So the aortic valve is what we call the outflow valve of the left ventricle. The left ventricle is the main pump that pumps blood to our body, and the aorta is the main blood vessel that takes blood from the heart to the entire body. Between the left ventricle, the pump, and the aorta, the pipe, there is a valve, and we call this the aortic valve.
What are some of the common problems with the aortic valve?
The two main problems with any valve, including the aortic valve, is aortic stenosis, or blockage of the valve, such that it makes it hard for the pump to pump blood into the aorta, and aortic valvular insufficiency, or leakage, where blood, once it's pumped into the aorta and the heart relaxes to fill with blood from the lungs, then the blood can flow backwards because the valve is leaking, which makes the work of the heart harder because it has to pump extra blood in order to keep the right amount of blood flowing forward.
Are there common diseases that impact the aortic valve?
The most common problems with the aortic valve are aortic stenosis. And there are two common reasons why people get aortic stenosis. There's what we call bicuspid aortic valvular disease, which people are born with. They live with it for much of their life, and then typically in their late 50s, 60s, or 70s, they will start to develop problems with that valve as it wears out and becomes blocked. In older patients, a normal valve that was normal at birth can do the same thing, and we call that tricuspid calcific aortic stenosis. And we see that generally in older patients in their 70s, 80s, and 90s.
Is the actual structure of the aortic valve changed then in people that are born with bicuspid disease?
Yeah, so normally there are three cusps or three moving parts to an aortic valve. The most common problem that a baby can be born with that affects the heart is a bicuspid aortic valve. And that may be because two of the cusps are fused together so that they function as one cusp, or it may be because there are only two cusps there. In either event, the valve still can function normally in the majority of instances. A minority of patients will need something done about their valve when they're a child or a young adult. But as they get older and that valve starts to deteriorate from increased stress because it's not a normal valve, that valve will start to scar and then eventually calcify. Once it starts to calcify, it becomes very stiff, it doesn't move very well, the valve becomes blocked, and it gradually becomes harder and harder and harder for the heart to pump blood to the body. Once that becomes severe enough, where we call it severe or critical aortic stenosis, the patients generally have symptoms, so they'll start to be short of breath when they want to do things. And over time, they may be very fatigued. They may also get chest pain. And sometimes they'll get dizzy or even pass out. And those are the symptoms of aortic stenosis, whether it's from bicuspid disease or tricuspid calcific disease. Once the symptoms develop, we know that if we don't fix that aortic valve, 50% of patients are dead in less than 2 years, and 95% are dead in 5 years. So suddenly it becomes very important for us to fix the valve that's been diseased for many, many, many years, but now it's at a point where it's threatening the patient's life.
So it's important to recognize these symptoms that you've been telling me, even though they're new for the patient, they might have known they've had this problem, so they're not expecting that it's causing any problem now.
Well, some patients will have known that they've had a heart murmur or a heart valve problem for many, many years, and they lived with it for many years, and then they'll start having symptoms, and it's a surprise that suddenly their valve now needs to be replaced. Many patients won't even know they ever had a problem with their valve, and they'll start having symptoms, they'll not be sure what it's from, and hopefully their physician will listen to their chest, pick up the heart murmur, and order what we call an echocardiogram, which is how we generally document or diagnose or demonstrate problems with the valves in the heart.
So how do you repair an aortic valve then?
We can repair some aortic valves. Mostly those are leaky valves.
Okay.
The degenerated, deteriorated, calcified, scarred, old stenotic valves, whether from bicuspid disease or from just what we call senile calcific aortic stenosis, those valves, in general, we have to put a new valve in for the patient. And there are two general classes of valves that we can put in. We can put in what are called mechanical valves, which are made out of artificial material and which last virtually forever. They never wear out. However, they require strong blood thinners, and so we mostly use those in younger patients. And then in older patients, we'll typically use what's called a bioprosthetic valve, which is a valve that's made from animal material. The thing people have frequently heard of is a pig valve, and it's calling a bioprosthetic valve a pig valve is like calling a leather jacket a cow's skin. It's a very high-tech manufactured product that's made from animal material. These valves do not generally require strong blood thinners because being animal material, the blood doesn't want to clot on them. However, if you have one long enough, eventually it will wear out, and they will last anywhere from maybe 10 to 20 years, depending on the age of the patient, the size of the valve, the type of valve that's implanted, and other factors.
Then when they wear out, then you're going to start getting the symptoms again.
Correct. So when the valve starts to wear out, typically then we see more leakage of the valve than we do stenosis, but we can see either one in a failing bioprosthetic valve. And again, we want to make sure that we put the right valve in the right patient the first time so that we minimize those risks. We have new technology available that allows us to put some of these valves in some patients without opening their chest or stopping their heart, which is amazing technology that's called transcatheter aortic valve implantation. And one thing that we can do if we have a failing bioprosthetic valve is do what's called a valve-in-valve and put a transcatheter aortic valve inside that failing valve and prevent the need for a second surgery for some patients.
Amazing, amazing, very interesting. We're going to take a break and come back, and then we're going to talk a little bit about the mitral valve.
Thank you.